A phlebotomist collects a PT/INR sample, but the tube fills only halfway. What is the main risk? A. Elevated calcium levels. B. Incorrect anticoagulant-to-blood ratio. C. Hemolysis of red cells. D. Loss of clot activator. Answer, B. Light blue tubes require a full draw. Underfilling disrupts the 9:1 blood-to-citrate ratio, producing invalid coagulation results. Which condition requires using a warm site before capillary sampling? A. Hypervolemia. B. Peripheral vasoconstriction. C. Hyperglycemia. D. Hemoconcentration. Answer, B. Vasoconstricted fingers yield poor blood flow. Warming increases arterial circulation for an accurate capillary sample. A stat lactic acid is drawn without a tourniquet. Why? A. To prevent calcium binding. B. To avoid hemolysis. C. To reduce falsely elevated results. D. To stop platelet clumping. Answer, C. A tourniquet increases anaerobic metabolism and artificially elevates lactate, so no tourniquet is recommended. Which tube must be drawn immediately before the gray top tube? A. Lavender. B. Gold. C. Light green. D. Light blue. Answer, A. After lavender, the gray tube is typically drawn to avoid interference from fluoride additives. During venipuncture, the needle bevel is seen under the skin but no blood enters the tube. Best action? A. Push needle deeper. B. Withdraw completely. C. Pull back slightly. D. Change tubes. Answer, C. The needle may have pierced the vein wall, backing up slightly often repositions it in the lumen. A bilirubin sample sits exposed to fluorescent light. What happens? A. Increases. B. Decreases. C. Turns hemolytic. D. Gains lipemia. Answer, B. Bilirubin is photosensitive, light exposure degrades it, leading to falsely low results. A patient is on heparin therapy. Which test must be processed immediately? A. CBC. B. Hemoglobin A1C. C. Anti-XA. D. Vitamin D. Answer, C. Anti-XA is time-sensitive and must be analyzed promptly to reflect true anticoagulant levels. A specimen for ammonia must be transported how? A. Chilled on ice. B. Warm pack. C. Room temp. D. Light protected. Answer, A. Ammonia rapidly increases at room temperature. Chilling preserves analyte stability. What occurs if EDTA contamination enters a serum tube? A. High calcium. B. Low potassium. C. High potassium. D. High glucose. Answer, C. EDTA contains potassium. Contamination produces severely elevated K+ levels. Which test is most affected by hemolysis? A. Sodium. B. Potassium. C. Chloride. D. TSH. Answer, B. Hemolyzed RBCs release intracellular potassium, making potassium results unreliable. Which vein has the highest risk of nerve injury? A. Median cubital. B. Cephalic. C. Basilic. D. Accessory cephalic. Answer, C. The basilic vein lies close to major nerves and the brachial artery, increasing injury risk. A specimen for cold agglutinins must be handled how? A. Frozen. B. Kept warm. C. Centrifuged immediately. D. Exposed to light. Answer B. Cold agglutinins react at low temperatures. The specimen must remain warm until processing. Which test must be drawn without stasis? A. Lipid panel. B. Potassium. C. Lactate. D. ESR. Answer C. Stasis increases anaerobic metabolism, falsely increasing lactate. A heel stick exceeding 2.0 mm depth risks what? A. Nerve damage. B. Bone injury. C. Arterial bleeding. D. Hemoconcentration. Answer B. Newborn heel bones are close to the skin. Too much depth risks osteomyelitis. The most critical step in specimen identification is A. Site selection. B. Tube inversion. C. Labeling at bedside. D. Tourniquet placement. Answer C. Mislabeling is the #1 cause of fatal lab errors. Labeling must occur immediately at collection. A fasting glucose sample is drawn after the patient drank juice. Expected effect? A. False high. B. False low. C. No change. D. Hemolysis. Answer A. Caloric intake shortly before testing elevates fasting glucose values. A lavender tube is overfilled. What occurs? A. False low WBC. B. Clotted sample. C. Altered RBC morphology. D. Excess anticoagulant. Answer B. Overfilling a lavender tube can prevent proper mixing with EDTA, leading to clotting. The most reliable site for venipuncture in severe obesity is A. Wrist. B. Hand. C. Median cubital. D. Ankle. Answer C. The median cubital is deeper but still most stable and least risky for complications. A specimen for blood culture grows no organisms because the site was not cleaned properly. The result is A. False positive. B. False negative. C. Hemolyzed. D. Lipemic. Answer B. Inadequate cleaning may kill surface bacteria, yielding falsely negative cultures. A phlebotomist draws above and 4 running saline. What is the consequence? A. Hemoconcentration. B. Diluted sample. C. Lipemia. D. Clot formation. Answer B. Drawing above and 4 collects infused fluid, producing diluted and invalid results. Which additive prevents glycolysis? A. EDTA. B. Heparin. C. Citrate. D. Sodium fluoride. Answer D. Fluoride inhibits glycolysis, preserving glucose. Why must blood cultures be drawn before antibiotics? A. To reduce hemolysis. B. To capture organisms before suppression. C. To avoid lipemia. D. To maintain tube vacuum. Answer B. Antibiotics can suppress bacterial growth, making cultures falsely negative. The Allen test checks A. Venous pressure. B. Ulnar artery patency. C. Capillary refill. D. Platelet function. Answer B. It ensures the ulnar artery can supply the hand if the radial artery is punctured for ABGs. A newborn bilirubin sample must be collected in which manner? A. Shielded from light. B. On ice. C. With stasis. D. Using heparinized syringe. Answer A. Bilirubin degrades with light exposure. Protection prevents falsely low levels. Excess shaking of tubes causes A. Lipemia. B. Hemolysis. C. Dilution. D. Clot formation. Answer B. Vigorous mixing breaks red blood cells, causing hemolysis. Which needle gauge has highest hemolysis risk? A. 21. B. 22. C. 23. D. 25. Answer D. Smaller needles produce more shear stress on RBCs, increasing hemolysis. A patient with a double mastectomy should be drawn A. On either arm. B. On fingers only. C. With a heel stick. D. Using a hand vein. Answer D. Arm draws are avoided, hand veins are the safer alternative. A lipid panel drawn non-fasting may show A. Low sodium. B. High cholesterol. C. Low potassium. D. High bilirubin. Answer B. Dietary fats elevate triglycerides and can increase total cholesterol. An ABG sample must be transported A. On ice. B. At room temp. C. Heated. D. Light protected. Answer A. Cooling slows metabolism and gas exchange, preserving accurate results. What is the biggest risk of drawing from the foot? A. Lipemia. B. Nerve injury. C. Clotting disorders. D. Thrombosis/embolism. Answer D. Foot veins have higher thrombotic risk and are avoided unless approved. A lavender tube that clots indicates A. Not inverted. B. Too warm. C. Wrong needle size. D. Excess EDTA. Answer A. Lavender tubes require gentle inversion. Failure leads to clotting. A patient standing during venipuncture risks A. Hemolysis. B. Fainting. C. Lipemia. D. Hemodilution. Answer B. Standing increases syncope risk. Seated or reclined is safer. Which tube is used for troponin? A. Gray. B. Gold. C. Lavender. D. Red. Answer B. Troponin is a chemistry test collected in serum separator, gold, tubes. The most critical factor for blood cultures is A. Tube color. B. Order of draw. C. Volume of blood. D. Patient fasting. Answer C. Adequate volume ensures enough organisms are captured for detection. What happens if a tourniquet is left for 3 minutes? A. Hemodilution. B. Hemoconcentration. C. Lipemia. D. False anemia. Answer B. Prolonged stasis concentrates cellular elements and alters analytes. A sample collected after vigorous exercise may show A. Decreased lactate. B. Increased potassium. C. Low bilirubin. D. Low hemoglobin. Answer B. Exercise releases intracellular potassium and increases metabolic byproducts. When drawing from a child, the best pain reduction method is A. Deep insertion. B. Warming pack. C. Topical anesthetic. D. Using larger needle. Answer, C. Anesthetic creams reduce pain and anxiety for pediatric venipuncture. A pale top tube requires A. No inversion. B. Immediate freezing. C. None for CPT. D. Exact volume. Answer, D. Some specialty tubes require precise fill for accurate plasma separation. Hematoma formation is mainly caused by A. Needle in vein too long. B. Poor anchoring. C. Failure to apply pressure. D. Low hemoglobin. Answer, C. Insufficient post-draw pressure allows leakage of blood under the skin. What happens if serum is left on cells too long? A. Sodium decreases. B. Potassium increases. C. Calcium increases. D. Glucose increases. Answer, B. Cells leak potassium into serum if not separated promptly. Which test needs anaerobic collection? A. Calcium. B. Magnesium. C. Lactic acid. D. TSH. Answer, C. Lactic acid rises in the presence of oxygen. Anaerobic draw prevents false elevations. Why should alcohol not fully dry on newborn skin? A. Prevent clotting. B. Avoid burning the skin. C. Increase flow. D. Improve accuracy. Answer, B. Alcohol can irritate newborn skin. Minimal drying avoids stinging. A hemolyzed bilirubin sample shows A. False high. B. False low. C. No effect. D. Clot formation. Answer, B. Hemolysis and light exposure both decrease bilirubin levels. The most accurate site for capillary glucose in adults is A. Thumb. B. Earlobe. C. Middle or ring finger. D. Index finger. Answer, C. Middle and ring fingers have best capillary beds and lowest nerve density. Which test requires chain of custody? A. TSH. B. Drug screen. C. Troponin. D. Platelets. Answer, B. Drug testing requires documented handling to ensure integrity. During a draw, the vein collapses. Best step? A. Use larger tube vacuum. B. Remove tourniquet. C. Switch to syringe method. D. Push needle deeper. Answer, C. Fragile veins collapse under vacuum. A syringe gives gentler pressure. A lipemic specimen typically affects A. Triglycerides. B. Glucose. C. Electrolytes. D. Hemoglobin. Answer, A. Lipemia reflects high triglycerides, causing cloudy serum. A patient refuses venipuncture. The phlebotomist should A. Proceed. B. Get another phlebotomist. C. Notify nurse/stop. D. Restrain patient. Answer, C. Patients have the right to refuse. Notify nurse and stop immediately. A light blue tube with a clot indicates A. Overfilled. B. Not inverted. C. Too cold. D. Contaminated with EDTA. Answer, B. Coag tubes must be inverted to mix citrate. Failure causes clotting. The safest approach for a confused patient is A. Draw while standing. B. Use restraints. C. Ask staff to assist. D. Skip ID verification. Answer C. Staff assistance prevents sudden movement and maintains safety.